Welcome back to this video series where we explore how the NCSBN's clinical judgment model relates to the NCLEX exam and look at it at a practical application. In this particular video, we're going to look at items number 3 and 4 from the 6 cognitive skills, which are generating solutions and prioritizing hypotheses. Now, we're going into question number 4 on our exam. So the order is not exactly always, or that's not really an exact determining factor. And it depends on the flow of the case study to see how these cognitive skills fit in. But you're always going to be tested on all 6 cognitive skills in the same order. These particular skills, number 3 and 4, can also be related back to the nursing process of the planning and also the implementation phase. So let's go ahead and look at our patient in the case study that we've been looking at. So here we're looking at item or question number 4 of this case study, where we are expecting that we're in the emergency department and caring for the 62-year-old client that we're suspecting is having an ischemic stroke. So now we're given some potential interventions here, and we are asked to specify if the intervention is indicated or contraindicated for the care of the client. So obtaining a 12-lead EKG is definitely indicated because we know that atrial fibrillation puts the patient at high risk for clotting as well as stroke. So we need to find out what underlying rhythm this patient is in. Number 2, implement fall risk precautions. We determine that the patient has positive right-sided arm drift and right lower extremity weakness, so definitely they're at high risk for falls. Offer the client small sips of water. Well, we have to be careful with that because their speech is slurred and they typically need a swallow and speech evaluation before we can give them anything by mouth. Number 4 here, perform frequent neurologic assessment. That's absolutely a given because the patient is currently experiencing that ischemic stroke. Ensure tissue plasminogen activator is available, and that is a thrombolytic that we should definitely be anticipating to get an order for administering to the patient because of this ischemic stroke, and then apply sequential compression device to bilateral lower extremities. Well, definitely because the patient is already having a clot and they are going to be in bed as we treat them for their ischemic stroke. So now these interventions here, we have figured out which ones are indicated and contraindicated, and it kind of also pertains to kind of prioritize these as to how to do them, which one are needed and not. And again, remember, you have your explanation down here. So it explains to you how and why these are indicated or not indicated. And then again, we have the physiological adaptation from the NCSBN's client need category here. So thank you for watching this video as we follow this case study about this patient with this ischemic stroke. Check back for the next 2 videos where we explore the remainder of the case study. Thanks so much for watching, and we'll see you soon.